only based on
Hey,
Friday.
great Tuesday evening. It is an amazing Tuesday evening in the city of Brownsville. It is Taco Tuesday. Taco Tuesday. And let me tell you, I actually just got back from Harlingen, and I was craving me some good old little tacos, but decided to go to Walmart and buy me some cheese instead and a salad. Hey, Joe, my man, how's it going? Because es tiempo de empezar a perder peso. Hey, Jessica, I'm still waiting for my mostachón. Sigo esperando pacientemente. Víctor, buenas noches. Carlos. It's a beautiful evening. Actually, it was a beautiful day in the city of Brownsville. It got kind of cloudy, and you thought it was going to rain, but it really didn't rain that much. But maybe the next couple of days. And we have two amazing guests today. We do have Dr. Mario Cerdan, neurologist from Brownsville and from Harlingen Valley Baptist. How you doing, Dr. Cerdan?
Hey, pretty good. Thanks for inviting me again to your show. I think you guys need to start giving me a permanent chair there with you guys. I'll be like, it's gonna be the Erasmo, Frankie, and Cerdan show.
Hey, let's do it, bro. Let's do it. It's a done deal. Sign the contract.
You never know. I could be expensive though. Nah, just kidding. No, it's Taco Tuesday. It's Taco Tuesday. 2x1, and I'm ready to go. I'll sign it. I'll sign it.
Awesome. Hey, Doreen, I actually found 2 sports coats, which were amazing. I'll show you them tomorrow. I also got one Robert Graham shirt, and I bought some botas chuntaro. So I actually have them on. Botas chuntaro. These things are amazing. I love it. I bought those today. Hey, they're Dolce Gabbana. I don't know.
Dolce Gabbana.
Para que veas que no sé nada de marca. Dolce Gabbana, whatever. D&G Botas Chuntaro with a piquito on the side. I thought it was a great buy. And tonight we have the honor of having Vice President for AOBE, Michaela Escobar, with us today. How you doing, Ms. Escobar?
I'm good. Thank you for the invitation.
No, it's always a pleasure to have individuals that are so involved with the community, especially with our children, with our amazing teachers. And again, AOBE has done an amazing job, and it's always an honor to have representatives from our teacher associations here with me. So let's start off real quick. It's going to be a long 3 hours tonight, so let's get into them real quick. We, as of yet, have received no numbers from Cameron County, but they'll probably hit around 10 o'clock as usual. We're about to finish, but that's okay. That's expected. With that said, we did get numbers from Hidalgo County. Hidalgo County numbers are at 248 positives today. Not the week, not the past couple of days. Today. And I want individuals to understand one thing about Hidalgo County. Hidalgo County doesn't rest. Here in Cameron County, we don't have numbers on Sunday because there's just no numbers on Sunday. Hidalgo County produces numbers every single day. So a lot of people could think, oh, well, it's la acumulación, the compilation of a bunch of days. Today, 248 positives for Hidalgo, 2 deaths in Hidalgo as well. And, some with underlying conditions. Dr. Cerdan, what did this incredible spike in numbers tell us?
Well, it's telling us that definitely our curve is going up and higher and higher. Is this a record number for Hidalgo? I think it is, right?
Yes.
So it's crazy. And I'm living it also here in Cameron County, in Brownsville, Harlingen. Definitely the hospitals are getting full every day. It's a higher number. And obviously that is telling us that right now we're in the middle of the storm. We're living probably the worst days, and we should definitely start working on how can we, prevent the contagious and diminish how this virus is spread in the community. But it's telling us that we did a mistake, something we didn't do it correctly, and we need to concentrate on that, obviously, to slow down the spread.
Well, I will say that, again, and we have had several conversations, Dr. Sardan, and I think we have been on the same page in regards to no se confíen, no se confíen, no se
Mm-hmm,
confíen.
mm-hmm,
Despite the fact, and I will say, despite the fact that a lot of our local, leadership, a lot of the state leadership was becoming a little bit lax in regards to it. I think one of the things that we were able to see, it was a trend throughout the nation and throughout the world. Because that's what science tells us. Science tells us you study, you review, you talk about, and you open up dialogue.
right.
Where did the state and local leadership fail us, doctor?
I don't know if it was an actual fail. I think, and I'll put myself also on the ground. I'll put myself that I failed too in a way. If you have seen some of my videos that I posted on social media
I
and
love
on
them.
YouTube, I I make an assumption, and sometimes making assumptions can be a big mistake. And I made the assumption that common sense will make a difference in our community. I made the assumption that people will know that whenever they're stepping out from their houses, they will use a mask. And so I was open to the possibility of restarting and opening more the economy, opening restaurants and other venues, because I made the assumption that the community will actually start using masks, but that didn't happen. If you see my videos, never in those videos, I never start saying, hey, as soon as you step out, you use a mask. I made the assumption that everybody will know that. So I start concentrating on more, in my point of view, more difficult things, people will not know. How to open a door when they're going to a restaurant, how to actually eat on a restaurant, what they need to do, like the steps to go into a restaurant, how to be clean, how to look on and safety measures when they're going to a restaurant, when they're going into to a supermarket to buy groceries. But I never actually felt that something that simple, that was please use a mask, was so important. And I think I failed. And I think I'm honest. I think that was one of the mistakes that I did. And I don't know if our government maybe also assumed that they will do that. And I think that was a major problem in my point of view.
Jonathan, thank you, Jonathan. Appreciate that. Real quick, before I lose the question, Doctor, and I don't think it was necessarily a fail, Doctor Cerdan. I think, again, and we've shared this again. We spoke about this regularly. It is a novel virus. We are learning as we go. But I think
Right.
one of the things that bothered me was how fast, all of a sudden everybody wanted to open up and to start bringing people and bunch in little big old groups. And I'll give the example because I am very, very confident that the reason that we have these 20 and 30-year-olds to the amount that we have them is because the bars started to open y se amontonaron así. Something that now that I think the governor, even today, was starting to retract and say, oh, let's rethink las grandes ocupaciones, the big groups of individuals. So I think that's what started to happen. And I think it's still part of the issue. And I think you lost your ear.
Yeah, I'll pick it up. The good thing is that I still went one left. So if by any chance it drops, then you're gonna need to help me with that. So I think that it was a combination of things. It was a big mixture of small things, right? The one is being locked down for 3 months in a row, right? A lot of people start getting depressed. There was a lot of psychogenic problems going on, depression, anxiety, other medical problems were growing up too, in association with opening everything at the same time. Exactly what you said. I don't know if you remember, with one of our live shows, we discussed about the possibility of slowly opening the economy.
Right.
Started with maybe restaurants and first like parks, then restaurants, big open places, stuff like that, and then in the end, small venues, small places like bars and etc. And everything depending on the curve. Everything depends on how the community was leading into those decision making, right? And instead of doing that, sadly, the state decided to open everything at the same time. So it's like you have everybody contained, right? And then suddenly you open it, but everybody was going to do everything. And the problem is the combination of everybody doing everything what they wanted, but without the proper measures. That was, and the other thing is also, we as a community, we also assume that the virus will slow down with the summer, and that didn't happen, and it's not going to happen.
Nope.
I am here to confirm that do not let the summer is going to slow down. And we all physicians, no matter who, said, we don't know, it's the first time, it's the first pandemia, but we think that in the summer it's going to slow down. And guess what? That didn't happen. So I think it was a combination of things, right?
Doctor, I just want to reiterate what Erasmo previously mentioned. I feel that we as a community have failed not only you, but our medical and health officials, because we saw today how Texas had a record high of almost 5,500 positive cases throughout the state. A large of it could be attributed to the age brackets of the 20 through 40-year-olds of the bars and things like that. Now with 4th of July coming around, how would you suggest we handle this? Do you anticipate large gatherings at the beach, or what suggestions would you have in regards to these celebrations?
So first of all, mask is mandatory. Social distance is mandatory. This is not a question of, can we do it? Should we allow? No. It should be mandatory by state law, and there should be consequences of going outside without a mask. That would be the first thing. Second thing, I will allow things in the open spaces. Okay, so parks, fireworks type of thing. I think that is okay, but everybody going into one place, it's about common sense. If you're gonna gather everybody in one bar, even if it's open, probably not a good idea, right? Spreading the community or spreading a social venue or social event with the proper social distancing and everybody using a mask, probably okay, probably a good idea. So again,
what do you think about the children? Small age children.
What do I think about the children
in regards
in regards to what? I'm sorry.
To safety. I know they're not used to wearing a facial mask. What do you recommend for our children that are maybe from 8 to 12 years old?
This is what I will do in my children, and they're not even 8. They're 7 and 4. Okay, and I have a baby, but I'm not gonna count that baby. Obviously, I don't. But the 7 and 4, I do so I'm trying to teach them, okay, and it's my responsibility about the new normal. I'm teaching them how to live under these new circumstances. I don't want to make them feel fear as a feeling of, we talk about this, I explain this in a more easy way as possible. They know that is working in helping people with this virus. They know that there's a virus, but I'm trying to show them to respect the virus, to explain in detail what you need to do to prevent this infection to happen, right? So to answer your question, I basically have teach them that when they're out of home, they need to use a mask. And obviously I bought a specific mask for kids that's small in size, that is breathable, okay? It's not an N95. We don't want to cover the whole thing, obviously nose and mouth, but, small, and has figures. In that way, they think it's fashionable. I teach them to tell them like, hey, look at this. This is like using an accessory, right? So my 7-year-old, it's a girl, and she likes everything in terms of fashion. So I'm trying to put them as a play game, educational, and to respect what we're living and teach them how to live. Because the problem that I have, Michaela, is that I don't know when this is going to be over. And I don't know what the schools are, what they're gonna do to prevent this spread to happen. But I want my kids to know how to prevent this to happen to them, right? So washing hands, the proper manners. I was one of them. I'm honest. I bring them to several restaurants because I want to teach them how to behave in a restaurant.
Yes.
And so my school opened for like a summer, and I teach them, like it was a couple of weeks, and I teach them how to be on school, right? And in the way that I think is the best way for my kids.
Let
Okay.
me answer this question really, really quick, guys. Like, good evening. I have a question brought to my attention that a substitute will no longer be receiving unemployment after July 6th. Guadalupe, that is not correct. What they're requiring after July the 6th is that now, before you did not have to report any work searches. Now you have to report work searches. You're gonna have to report 3 for every week that you're on unemployment, Guadalupe. If you have any more questions on it, please inbox me and I'll share with you more information. Again, it's not that you're not going to get any more employment, is that you now have to report at least 3 work searches. Michaela, one of the questions that the comments that Juan Carlos made was the numbers are going up, keep increasing. Our business reporting, not imagine where schools open. Is AOBE concerned in regards to school openings with COVID-19 raging in the city of Brownsville?
Not only are we deeply concerned, but we are affiliated with the state, the Texas State Teachers Association, and we are actively promoting safety for the children, safety for our employees. So Mike Morath was supposed to give a press conference today, which he canceled at the last minute. And having said that, he's leaving everything on local leaders. So local leaders are going to decide what we employees and what our children are going to be facing. So AOB will be in the front line advocating, but we do practice what we preach, safety first. So our communication has been through phone calls, conference calls, Zoom meetings, whatever it takes to communicate with our leadership.
Dr. Cerdan, is it disheartening for you in the medical profession to hear that our school districts plan to go back onto campus and have the option of not wearing face masks to students and to teachers?
No, I this is again my personal opinion. Don't take this, written stone that it has to be like this. I'm not any representative of the CDC or anybody. Okay, this is just a physician talking, and family in regards to family, how I'll proceed. I think it has to be mandatory in my point of view. Now, there's certain ways to do certain things, right? There's, and I've been telling the show multiple times. There, for example, and we need to be creative. Like, do you have to have all kids coming at the same hours at the same time? Can we divide certain hours for having a small number of children inside the school? Do all kids needs to be inside their house? In their house, inside the school room, right? Inside the rooms at all times. Can some of these classes be outside? Stuff like that. Can we be creative? Can you, if by any chance we feel that kids will not remain with the mask all the time, it may happen. Can we use other certain measures to prevent the spread to happen? Can we have some certain, barriers in their desk, right, to prevent the virus to spread if by any chance somebody's infected? Those type of things that, I'm not an expert on, but, things that we as a community and the school district to be a creative in terms of decreasing the amount of spread. But I think using a mask will definitely need to be something that I will teach my kids to use. That's what I did. And I think I'll continue doing that if they allow me to.
Dr. Cerdan, I would just like to share, Carlos, with you and your public that as of AM, 90% of the ICU beds at Texas Medical Center are full. TMC is the largest medical center in the world. Thank you, Carlos, for sharing that with us. Dr. Cerdan, how bad is the situation in regards to ICU beds here locally for us?
So I don't know the specific number. Like, I cannot tell you like if it's 80% or 75%. What I can tell you is that, in some of the hospitals that I work with, they expanded the unit. So the COVID-19 unit is bigger than it was in March, and the ICU in the COVID unit it's full at this moment. Now,
full
is the whole hospital full of COVID-19? No, it's not. But we're definitely we have a bigger number of cases in the hospital. That is for sure. There's no question about that.
Doctor, is there anything that we should be alarmed of? I've read recently about an African dust or the symptoms. Is that something that we should be alarmed here?
No, I don't think so. I mean, we need to be careful about the things that we have discussed since the beginning. We need to be careful about this. Remember, the virus is not, it doesn't, the virus doesn't walk by itself. We actually, walk with it. We spread it. We are actually the vehicle for the virus, okay, with the transportation of the virus. So social distancing is extremely important, and, washing hands and, trying to prevent the virus to spread into the community by using facial masks. So yeah, definitely we need to be careful on how we actually spreading this virus in our community.
Dr. Cerdan, you become immune after getting the virus. One of the doctors here in the Valley actually, tested positive, came back, tested negative, and then all of a sudden is back into the positive range. Do we have a better grasp of what recovered is? Or someone testing negative after they've been tested positive?
So what the community is doing is social isolation after one is tested positive, and we're taking more certainty on nasal swabs. Okay, and if the PCR of the COVID-19 is positive, we start social isolation for 14 days. And then around day 14, we retest with a nasal swab again. We check for PCR, and the patient will not allowed to be outside their social isolation until the PCR come back negative.
Michaela, one of the concerns that a lot of individuals have shared out there is in regards to insurance. And a lot of it has to do with their coverage. Some of the questions that I've received are, will our school district's insurance be paying for a lot of these testing, treatment, and retesting of individuals? Do you have any information in regards to it?
The only thing I can tell you is the BIC insurance is very full of benefits. I would recommend they call the employee benefits department in regards to what it covers or doesn't cover.
Dr. Cerdan, in your practice, are you seeing a lot of individuals in regards to a lot of people that are out there testing, not having the means in order to pay for treatment? One of the things that the city of Brownsville provides is testing at no cost to individuals. Are we also providing continued care for individuals that have tested positive?
To be honest, I don't know, because I am actually not in any way, I'm not in charge or manage how it is in the clinic. As a neurologist, I focus more on neurological conditions. And obviously I see patients with the infection inside the hospital, but to be honest, I cannot answer the question because I'm not sure about it.
One of the concerns in regards to the upcoming events, going out, coming back, coming out, going and coming back, is that a lot of the individuals that in our 20s, are going to be carriers of this virus. Now, we had a particular case, special case, in regards to a 21-year-old that passed away this weekend at the hospital. We also were shocked to see not only individuals that are months old start to appear on our list here locally, but we also had a newborn pass away. Is there any information in regards to newborns?
So it's so it has a lower incidence of mortality, obviously, than the elderly, as we know from the studies coming from Italy, Spain, and China. So we, in a way, we're seeing the same thing here. The problem is that now, we're testing more, and by testing more, we're actually having more positives. But at the same time, that is not related to the amount of people that are getting treatment and managed in the community. Now we have personal people that have been positive, that have symptoms, and a lot of people are hospitalized. That's independent on the amount of the amount of tests that we're doing in the community. It's good, I think, that we're doing tests, but that is what is happening, is that we're seeing more asymptomatic positives. We have more carriers now, okay? But at the same time, we're actually seeing a lot of symptomatic people at houses and in the hospitals. So, it's to answer the question, it's kind of tricky because we still don't understand why some babies get symptomatic, kids get symptomatic, why 30 years old, 40 years old get severely symptomatic and they're hospitalized and intubated and some disease, and why some 80, 90 years old are okay. We still don't understand. There's maybe a little relationship maybe with the blood type, and it's still kind of more or less it's a very, very small percentage of increase of risk of morbidity and mortality with A than with B or with O. Apparently O has a little bit of lower risk, but again, it's very small. It's not big, the difference. So again, that's sad, that this virus it's so novel, so new to us that we still don't know exactly why some people are more at risk to have, complications than others.
People are
Doctor,
recovering.
with the recent spike in numbers, I have
Mhm.
heard lately that people have said everybody's getting it. It's good for our immune system to build up and get stronger. What do you say to those people that, in my opinion, have relaxed a little bit and have kind of given up and said, "Oh, this is going to affect everybody, and everybody's going to get infected sooner or later"?
So that is true. Sooner or later, we're all gonna get infected. Okay, that is true. Good argument. The problem is what we have tried to do for the past 4 months is to prevent this huge spike because we are living in an underserved area. Brownsville and Harlingen are underserved areas. We don't have enough ICU physicians, okay, intensivists. We don't have enough pulmonologists, so lung doctors. We only have one infectious diseases doctor, okay? For example, we're only 2 neurologists in Brownsville, right? So we don't have enough, tools to control this infection complication in the hospital. So we need to be careful. That's the whole reason why we're asking, as a physician community, as a health community, to you guys, please help us slow down the curve because this is getting out of control, and we need to control this as soon as possible because this is getting out of hand. In my point of view, it's actually already out of hand. We need to start working on controlling again to help. So by the way, thank you so much for allowing us to explain this to the community. In that way, we spread the word of helping.
People are recovering. Are they healthy? Are you seeing any organ tissue damage from COVID-19? What can we expect after being infected with the Rona?
No, what you should expect, and if you pass the infection and the risk of complications, there's really no major organ damage that we can see directly by the infection per se, right? Now, the infection can cause complications, right? So if you pass that moment, if you're actually out of the complication phase and you're completely recovered, no, I will say that there's no major organ damage. Now, if you actually get a complication, if you get infected and sadly your inflammatory process is extremely high, you start, throwing clots to the heart, to the brain, and you have a stroke, that by itself it's a complication of the coronavirus. Directly, coronavirus didn't cause, I'm saying, the stroke, but the inflammatory process caused by the infection is the stroke cause, and obviously that could be an organ damage. So, but let's say that you safely pass that complication phase, you're completely out of risk. Your immune system produces IgG, which is an antibody against the infection. Is like having vaccinated or being vaccinated. That's kind of the same purpose. And now for your next year of infection, if by any chance this little virus transmutate and becomes COVID-20, now your immune system already is going to be stronger than a de novo infection.
Good. Michaela, what does AOBE stand on the superintendent getting an extension or having such a high salary?
We believe in taking care of the front line. We believe in taking care of the teachers, the aides, the paras, food service, transportation. As you know, the decision is made by the board as to the extensions and the salaries. AOB has nothing to say in reference to that, but we will always advocate for the employees, the safety, their salaries, the safety of the children, anything that entails education.
Good. Well, one of the things that you mentioned is in regards to the front line, and we have seen a lot of our frontline staff, including a lot of our teachers, a lot of our staff that works at main building, a lot of individuals that are having hand-on contact. Dr. Cerdan, we've also heard of a lot of our first responders here locally in the city of Brownsville succumbing to, becoming positive. Are you concerned as one of our first responders, as one of our amazing doctors here, local area? Are you concerned with contracting COVID-19 and in coming into contact with your family? And what advice can we give our people out there in regards to interactions?
So I'm always concerned. I'm actually surprised that I haven't been positive yet, and I've been tested myself several times because I don't want to be an asymptomatic carrier of the infection. And to be honest, I'm surprised that I haven't been positive. Yes, I am concerned. As I said, I don't fear the infection, but I respect the infection. So I'm trying my best based on the guidelines to prevent this infection to happen to me and my family. And I do everything in my power to avoid getting infected with it. I never leave my N95 mask. I put it myself before going into the hospital, and I don't take it out. I don't move it until I'm out of the hospital. In between patients, I always wash my hands before and after. I put my gloves every time that I'm going to inspect the patient, no matter if the patient is COVID-19 positive or pending or even negative. I don't take chances. The good news is that in a way, that's what I've been doing, since I was a student, since I started training. So it's not like something that I felt that I needed to learn or to adapt. But obviously, and using an N95 can be hard, but that's what I do. I also built with my Episcopal Day School some of this masks, homemade, and we built a lot of these ones, and we gave it to the community. We gave it to the hospitals, and we're trying to protect as much as possible using our personal protective equipment in order to avoid getting infected. But yeah, it's something that we can have. As I said, I think sooner or later we're all going to be infected with this. Hopefully, it's after the vaccine is developed.
I'm going to need one of those clear masks because I have trouble with people not being able to see this beautiful face, and I don't want to take away from our community. One of the questions that constantly comes up a lot, Doctor, is in regards to our special needs students. A lot of our individuals out there with autism, a lot of individuals, that it's going to find it very, very hard to wear a mask. Any recommendations, suggestions to our folks out there, in the special ed community?
It's really, really hard, and every case is different. We need to take in consideration every single case as an entity. I do have some of my patients, obviously, as a neurologist, I do see a lot of patients that have autism. And, I try to help the family to understand the disorder. For special needs like autism, it's very complicated because they have a very specific way of doing things on a daily basis. And some of them, part of their schedule was to actually going outside and doing certain things on a daily basis because that was their daily schedule. And now they need to be at home. And obviously that creates a lot of problems, depression, anxiety, and other things. And it's really hard to see them in that way, but we need to teach them how to, as much as we can, we need to teach them how to live with a new norm and help the families, help the parents to understand this disease and to teach them. And everybody's different, so I think it depends on each case, but hopefully to help them avoid getting infected or infect some other people if by any chance they're asymptomatic carriers.
Would you recommend, doctor, that our special needs children possibly not go into the classroom in this upcoming year? Would that be your recommendation as a physician?
As I said, everybody's different. Every school is different, and every parent is different. I think every case is. We need to take each case, individual cases, right? So there's different spectrum of autism. There's people that can actually understand, and they are autistic, and they still can understand certain measures, and I think those kind of kids can maybe go to the school. But the other ones are really more into the severity or more severe spectrum of the disease, and maybe them will be more complicated to get them in the school. So I think it depends on the parents, it depends on the school, and it also depends on each patient.
Well, one of the things that we've always said, and Mrs. Escobar will not let us lie. One of the things that I've always said is, we have to include the professionals in regards to the decision making when it comes to educating our students. And we have such amazing counselors, amazing individuals out there that attend the needs of our students, our special needs students. I think it's going to be very important for the district to bend the ear and to start listening to its staff. The ones that have actually been working with our students for so many years, and give in a little bit. But something Dr. Cerdan mentioned is so very true. Every student is going to be different, and every situation is not going to be the same from one campus to the other. So it's kind of very hard. It's something that we experience in the state of Texas. The mandates that the state of Texas and TEA gave for our district and our area and our community, they just don't mesh with us. They don't mesh with us because of the different circumstances that we're living in. The same thing's going to happen with our special needs students. What's going to work out at Veterans High School is not necessarily going to work out at Rivera High School. It's just not. Dr. Cerdan, my father was your patient. Unfortunately, he was one of the first to pass away. He was a Solana hospital. He always spoke so highly of you. God bless you and your family during this pandemic.
I definitely, just by looking at the photo and the last name, I can definitely recognize him. I love him. I feel so bad when I heard about this, and thank you for your kind words, but I'm here to support you. No matter if he was my patient, you were my family, and I'm here to help you as much as I can. If by any chance you feel that you need some sort of help or support, don't hesitate to call our office and ask to speak with me. I'll be extremely happy to talk to you. God bless.
Dr. Cerdan, do you think that Brownsville having high numbers because of the graduations? If so, why the district's still not making precautions? I'll answer this one in part. And I'll answer this one in my opinion. Yes, any and every event out there where, again, it's look, folks, look, Joanna, we've been warning individuals, these events, when you have a lot of individuals grouping up all together, they're going to be so very, very hard to control. So yes, putting the students all together for a graduation, a lot of the other districts right now throughout the valley have decided to call them off completely because of what's happened. Because, we knew this was going to happen. Bringing the students onto campus for condition training and everything else was an immense mistake. And we're going to suffer for it as a community. So I'll answer the question. You better believe graduation was a humongous mistake. And individuals going to spring break was a humongous mistake. And people getting together in Memorial Day was a humongous mistake. And people going to get together on the 4th of July is stupid. It's just stupid. It's dumb. Don't do it. God, goodness gracious, why don't people out there in the community, especially our leadership, understand that the more we separate from each other, the shorter the time will be when we'll be able to come back together again? Dr. Cerdan, do you want to give your take on it?
I must say that at this moment, okay, because in a way we discussed this prior to the graduation day. I think it was like 1 or 2 days prior, and I said, you know what, at this point it's really hard to stop this, and we start concentrating on how to prevent the infection to happen. At this point, my advice would probably not to have any kind of venue that puts more than 50 patients inside a room, and definitely to be careful in regards the amount of hours and where it's going to be and how is it going to be. We need to really concentrate on that. But right now, we're really, and I want to make this really clear. Right now, we're in the middle of the storm. There's no question about that. And maybe the storm is just starting. You know what I'm saying? Maybe this is just going to continue and the numbers will continue to increase. So if we can avoid any kind of social interaction at this time, definitely in big gatherings, I'll definitely support that. I don't think this is the right time to do things like that concentrate a lot of people of the community, mostly because the chance of getting and spreading the infection is high. If we were in another situation, if we were, when the curve is slowing down, when we're almost done with it, when it's coming down, then probably we'll say that with certain measures, probably could be a good idea. But at this point, and knowing the community now, after learning that the community sometimes want to do what they want to do, it's going to be really hard. So probably safest probably not to do it.
We have to remember that in our community, we do have a lot of children with underlying medical conditions, and that just comes with our culture. And I think that's one of the things, Dr. Cerdan, that a lot of the individuals up in Austin, up in Washington, D.C. did not take into account. Like our culture here has a lot to do with the numbers being what they are. I mean, just who we are as Hispanics, as Mexican, abrazadores, besadores, and again, where we live in regards to reference to the Valley and our economics, they make a huge amount of impact. With that said, Doctor, one of the things that the know-it-alls up in Washington are saying that the second wave is coming. The second wave is coming. What does that mean for our area? And have we actually gone over?
I'm gonna quote Dr. Castillo here. I don't think we haven't finished with the first wave. I think we're still in the first wave, and I think we're climbing it right now. I think Dr. Castillo was correct on saying that, because I don't think we haven't finished with the first wave. We thought that we slowed down the infection process on the first couple of months by locking ourselves down, right? We stopped the infection spread by doing that. But now we're actually seeing the increase on the infection process because of that. So we need to be careful with that. And in regards why we as a community, I think we're having more infections. I think if you look at some of the states that have increased spike on the infections, there's a lot of Hispanic community. So Florida, California, Arizona, us. And I think it is possible because we're Hispanics, and part of the Hispanic community, as you said, we want to hug and we want to kiss and we want to see nuestra abuelita and we want to see our family and we want to check and make sure everybody's okay. And the problem is a combination of that with no education. Because I keep saying this, we need to learn, and I'm going to repeat it until the end of this live show. We need to teach the community how to live the new normal, and the new normal is prevention, and we need to teach them how to prevent the infection to happen. So it's about learning to do a new activity in the community. How are we going to teach them to go to school? How are we going to teach them to be out of home? Because we're social individuals. We're not going to allow ourselves to be locked down for the rest of our lives or until we have a vaccine. What if the vaccine happens in 2 years? Or what if the vaccine is HIV, like HIV, and we never develop an HIV vaccine? It's been more than 20 years and we're still looking for an HIV vaccine. We don't have it. And this could happen. Hopefully it's not the case, and I'm knock on wood. But what happens if by any chance we never allow ourselves and we never actually have a coronavirus COVID-19 vaccine? What's going to happen? And we're going to lock ourselves down for the rest of our lives? No. Right? So we need to start living in a preventive way, and we need to teach ourselves. It's like when you go to a restaurant, what do? You don't eat with your hands, right? You use utensils, right? Well, but you go. Yeah, you go to Whataburger, so it's different. But you know what I'm saying? So we need to we need to teach them, and that's the reason why I concentrate on my videos on teach how to do certain activities now during the pandemia moment.
Michaela, going back to what the doctor had previously mentioned regarding his recommendation of not having more than 50 people gathered together. As we know, TEA and the governor recently said that the students will be going back to the brick and mortar come the new school year. Can you tell us as to the sentiment of the teachers? Are they reluctant to go back into the classroom?
We had been sending a lot of surveys through AOBE, of course, and most of them are very afraid. They are concerned because they have underlying conditions, as it was mentioned before, and they want safety. And that's exactly what AOBE is advocating, safety first.
Correct. Well,
Love it.
Well, I think
Great.
that's very, very impressive is like do y'all truly believe, Mrs. Escobar, y'all truly believe that this superintendent and this board actually heed the surveys that are produced?
I can't speak on behalf of them, but I can tell you that AOBE will not stop. We will continue to ask questions, and as our member press their concerns to us, we will continue to communicate those concerns to administration and the board.
One of the movements that's going to start on Thursday is they're going to start someone is wanting to start a protest in regards to getting together and watching the meeting for members of AOBE, and not only watching the meeting, but maybe even doing a drive-through protest at the Glass Palace. Have you heard of that? Do you know anything about that? And what's going to happen on Thursday?
Well, actually, we're advocating for our members, as you mentioned, and we are asking our members to. I guess you got the news before we actually express it to anybody else, but we are asking our members to go to the main building and press their concerns, keeping social distancing, and telling, of course, administration that we are concerned. We want to make sure safety is first. We want to make sure the compensation reflects what they are doing. We are actively verifying everything from the current compensation plan to the one that's being proposed. And we are communicating with administration any concerns that are being brought to us. Case in point, the choir and the band. We already addressed it, believe it or not.
Yeah.
We may not be at the main building knocking on doors, but we are constantly communicating with administration to make sure that anything that is wrong or was left out by mistake is corrected.
And we're going to talk about the compensation plan in a bit. Dr. Cerdan, can you speak on the low number of deaths? I would be concerned if that high number of positive cases were followed by high number of deaths, but that doesn't seem to be the case.
So the answer, I think, is very simple. The reason why is because we haven't surpassed the threshold for our hospitals. But as soon as we pass that, as soon as we are not able to intubate people, and we need to start making decisions of who gets intubated, who doesn't, okay? And we start not being able to take care of the, infected patients, that's when you're going to see the number to be increased. And it's already obviously increasing the infection, obviously, because we're testing more, as we said in the beginning. We have more people in the hospitals, so we're starting to see the curve going up. I recently saw a video of our CEOs, Valley Regional and Valley Baptist, talking about this. So it's not coming from me, it's coming from them, okay? And we are noticing that, our resources are starting to be affected. So you're gonna start seeing a number of increase in the mortality when that is passed, sadly.
Well,
so hopefully it doesn't happen, but it may happen.
One of the first things that we saw, and again, Manny, we are very, very fortunate. We are very, very blessed, Manny, and everybody else out there that has this idea. We're very, very blessed to live in a very rich country with an amazing health services out there available to our citizens. One of the things that first shocked me, really shocked me, me puso a la alerta, was that video from Ecuador. You're talking about a lot of third world countries out there that don't have the means and don't have the resources that we have here in the United States. And you were seeing individuals falling on the street because they could get absolutely positively no care whatsoever. So I would dare say that our death rate is low because of the different preventative measures, the different health professionals that we have in this country. So we should be very, very, very blessed in regards to it. Now, one thing that we have to realize that the testing, even though the president says, hey, we're going to cut down the testing, and guess what? The numbers are going to go down. Well, yeah, but at least we could start to work on individuals at a
But the
quicker.
number, yes, but remember, this is extremely important. The amount of testing, if even if it's got lower amount of testing or higher amount of testing, is just that's a magic trick. You know what I'm saying? That's still it's still a mask.
Yeah.
In the end, the patient that is having dyspnea, meaning the patient that is having severe shortness of breath, is still going to go to the emergency room no matter if it was tested positive or negative. You know what I'm saying? Or no matter if the patient was able to test it himself or herself, right? It's going to still go to emergency room and still going to need a mechanical ventilation. So please do not get into this false idea of testing will change the numbers, or if we're getting more positives because we're getting more testing. Well, that is irrelevant with the number of people that are going to the emergency rooms and being intubated at this moment.
Doctor, could you tell us about the recovered? Is there a possibility that the people obviously could contract the virus once again? Could you give us a little bit more information as to those that have recovered from the
So
virus?
it's very small data. So I think coming from Italy, that some of them were like positive and then negative and then again positive. I'm not sure about it. I don't think it's very strong. I believe in two things. One, I believe in false negatives or false positives, right? So it is possible that the first one was false positive, and then on the second one was negative, and the third one was really an actual positive, right? Or a false negative, that you got infected, it was positive. The second one was still positive, but in that case was a false negative, and the third one was positive. I believe in that. I think that's basically what's happening, in my opinion. And the second thing that I believe in is that this no matter what, I'm 100% sure about this infection is going to mutate, because that's just what it is. It's what happens with all the infections, with all the viruses. All the viruses transmutate every year. A very small percentage of the anatomy, about 10%, and it becomes a different brand, right? So it's not going to be COVID-19, it's going to be COVID-20. And that usually will happen in the fall. So yeah, it is possible we're going to have a second wave of coronavirus infection with the COVID-20. That's very likely what's going to happen. And, we still don't have a vaccine for the first one. So, yeah, so those are the things. That's the reason why, again, I keep myself concentrating on how to avoid, getting the infection and teaching the community to prevent the infection to happen.
Dr. Cerdan, I know of the testing site, the sports park in Brownsville, lets people do the swab test themselves instead of the medical staff. Why is that being allowed? And is it?
To be honest, I didn't know about it. Like, maybe we can ask Dr. Hernandez if he's around, and maybe he can answer. But I didn't know about that. But it definitely needs to be done by somebody that's trained to do it, because the problem is sometimes you can have the swab in the nose and you don't want it there. You want it all the way to the back where the pharynx is. So yeah, I'm not sure, to be honest, if that is the case. Do you know about this? Like, do you guys know?
I have not heard of it. Actually,
I really doubt it, to be honest. But
we'll find out tomorrow. I think Dr. Hernandez is going to be on Friday. I have to ask. I have a friend that is still positive, but she received a letter from the health department that she is okay to go out in public. Is that correct? Can a positive person after 14 days go out and not transmit others?
Can you back to the question again? Yes. It was kind of quick. So that is still positive, but she received a letter from she's okay to go. No, okay, yes. I know. Please, I heard this before. I heard that if you don't have symptoms for 3 days, then you can go out. No, stay socially isolated for 14 days, please.
We have the numbers for Cameron County. 111 new positive cases, 1 death in Cameron County. 76 positives from Brownsville.
Slow, a little bit less than recently, right? It was like 100, 100 something.
101.
For Brownsville, that is our high. I don't think we haven't gotten anything over 76 before for Brownsville.
Oh, 76 just in Brownsville.
Yes.
What was
111 Cameron County.
Oh, I see. Sorry. My fault. Okay.
So, guys, that's not good. That's not good whatsoever. Michaela, what do the numbers tell you, Michaela?
We're not social distancing and we're not doing what we're supposed to.
I agree with her.
Safety first.
I definitely agree with her. We're definitely not doing our job. Us as a health community, spreading the word, teaching ourselves, teaching the others to, to be safe outside. And the community, it's tired of listening and it's tired of the virus, and they want to have their normal life before 2020. But sadly, that's not the case, and that's not going to happen. So we need to start thinking of, the new life, the new way of living.
Michaela, recently the governor had stated that that masks were not going to be mandatory. Is that something that the AOBE would be trying to have the district implement with this new year?
Definitely.
Well, one of the things I think studies, and this is a good question. Studies in China, kids in school, PE running at full blast with a mask on would collapse, lack of oxygen to the brain. In some cases, death appeared. Michaela, one of the things that is on the mind or on the compensation plan for the district is to somewhat shy away from PE, and maybe take away some of the days from a lot of the extracurricular activities, such as band, whereas even the band directors' numbers have been cut. Have y'all seen that at AOBE, and what is y'all response to it?
When we receive calls and concerns from our members saying that the beliefs were different, we addressed it right away. I mean, we did not hesitate to call administration and say, is this a mistake? Why was it changed? And it was corrected. I'm happy to report that it was corrected. So in the new copy, which should be posted hopefully by tomorrow, you will see that corrected. Now, our main concern is safety. And that's the first thing I'm going to say, and I'm going to repeat it throughout. We have to make sure that we maintain safety. The safety of the children and our staff are the uttermost importance. We have to make sure that even if the governor or the Mike Morath says that it's not required, it should be required. It should be required because we don't have control of this virus.
No.
So having said that, we will continue to advocate until it is a requirement. I mean, the state is allowing the districts to do whatever they feel is necessary, but that might not be enough.
No. Well, that was one of the big mistakes that the governor made as soon as he started to ease off restrictions. I mean, again, he didn't take into consideration our culture, our people, y lo necio que son a lot of our elected officials here in this area. Again, it just didn't take a lot of that into account. It was a big mistake. Now he's starting to retract and say, well, some of the authority, they should go to the county judge and to the city municipalities. I'm going like, duh, pues sí, burro. I read the antibodies, and I actually like the governor, so sorry, Governor. I read the antibodies don't last long in the body after a person is recovered. Is that true, Dr. Cerdan?
No, it lasts forever. You're always gonna have IgG positive antibodies in your system. It's like chickenpox, right? You have it as a kid, and you cannot have chickenpox again because you have antibodies to it, right? Sometimes you can reinforce, right, by giving a second vaccine when you're adult, yes, but no, this is not something that will go away right away.
So do you think that once you get it, you'll never get it again?
The COVID-19, remember,
but
next year is gonna be COVID-20. It's different, and then 21, and it's like influenza. You need to vaccine to influenza every year. So I think this is gonna be the same.
The board clearly does not advocate for anything about AOBE stands for. Vote the corrupt board off. Sorry. Out. Does VID have a COVID testing connection for their employees and students? Sorry, late for the show. Never let that happen again, Nolda. Please don't ever be late again. Michaela, do you know about any testing connection for employees and students?
I believe that I saw in one of the previous board meetings or insurance committee meetings that the COVID testing would be considered free or with no copay to the employees.
So that's for
Nice.
employee districts. That's a great thing.
For the employee who are insured within the district.
That's an awesome thing.
Good.
Once school's open, how are we going to handle it once a teacher comes back positive? Will their 2 weeks quarantine come out on the regular sick leave? Well, that's just, I guess, for you, Michaela.
I'll be honest with you, I don't have an answer, but I'll be happy to research it and provide it on the AOBE Facebook.
Good. I have one more question for you, Michaela, since I have you on the spot. Recently, the board approved the extension to the BISD health plan. From what was shared, this included nearly $300,000 in annual compensation to the insurance agent, even after the agent allegedly gave back over $300,000. This amount of money paid out over 3 years approaches $1 million. If Blue Cross Blue Shield had already agreed to do the job of the agent, this would have saved employees a huge amount of money that they could have put back in their own pocket at some point. Was AOBE aware of this, and how did they feel about it?
Okay, so I'm going to have to refrain from answering that question. But I can tell you that AOB will continue to advocate for all employees to make sure that we have the best insurance and, of course, the best benefits.
Do y'all want me? You want me to answer the question?
Go for it.
Well, let's stick to Dr. Cerdan. We got a couple great more minutes with Dr. Cerdan. I don't want to bore him with BISD stuff.
No worries. I'm here for you.
Good evening. Acabas de llegar, Lucy. Lucy, llega a tiempo. Parents can opt out of setting the doctor, and this is something that's very, very interesting. I mean, in regards to both AOBE and the doctors are here. A lot of the parents are going to make the choice. You know, one of the things that's very hard, Dr. Cerdan, and you're a parent. You know, you have a 4-year-old, 7-year-old, and a newborn. One of the things that parents are concerned is that the school districts are not necessarily going to have their children's best interest at heart, being that they are business. They are business. They're out there to make money, and they're going to cut curves here, cut curves there, in order to save a buck, in order to put another dollar in Sylvia's pocket. We already know that. But with that said, Doctor, what is your take in regards to parents, opting to make the choice of, what, I think it's going to be safer for my child just to stay at home and do homeschooling for him?
I think that, in my opinion, I think I would love to see that as an option. I would love to see me as a parent the opportunity to know if I don't feel comfortable to send my kid to the school, to be able to continue doing tele-education by different ways at my own home. Now, we obviously need to understand that every parent is different, and every family is different, and maybe both parents are working. So I think having the opportunity to allow the family to decide if they want to remain at home and have homeschooling, I think could be a good idea. And it can also reduce the amount of students that go to school, which obviously can reduce the amount of risk of spreading infection. But again, it's my personal opinion as a parent / physician. But everybody, I'm assuming, is different, and things will be different. Depends on the state and depends on the school district.
Eder Hernandez is saying 72 positives for June 18th. Is that backtracking a couple of days? I'm not understanding. Dr. Hernandez, if you could explain, I'm not understanding. I know that for today, that was, what did I say, 76? 76 positives today for Brownsville, 111. And I guess I'm going to think that maybe it's because we're reporting some days atrasados, which, to even that, doctor, since I have you on the line, let me put you on the spot. I'm frustrated. I'm very, very frustrated. I'm frustrated that we get positives come in regards to a lot of the different groups out there, a lot of the nursing homes, a lot of the positives that the county is sharing with us. And we know for a fact that there's actually more individuals. I've shared that a lot of the different facilities out here, as reported on the sheet that the Cameron County office produces, has numbers that are very minimal. And I'll give you another example. It's in regards to Alta Vista. I had a lot of individuals contact me today, just today. Hey, Erasmo, ¿qué pasa con Alta Vista? And I said, like, well, what's going on? I said, well, y'all were reporting yesterday. I said, yeah, the numbers that came out with the county. That's the ones we have in regards to a couple of positives and blah, blah, blah. Lo que sea. So we just called them and they said, no tenemos a nadie. No hay nadie. And I said, well, that's very responsible. Why?
So, can you explain again that? So, what you're saying is that in Alta Vista, their positive cases are not going to be counted like at all, or
well, they were on
or that it takes some days to be counted as positive.
A week or so.
They were on the sheet as positives, but when people were calling Alta Vista, they were telling them that no, they had no numbers. My concern is, why is it taking so long to report the deaths? Why is it taking so long to report the numbers, especially out at the different areas like our nursing homes out there throughout the county?
To be honest, I don't know, because I don't work with them. I don't know how they do certain things. So I apologize that I cannot answer the question. But now, don't be that frustrated, because if in the end they actually tell you that it's their positivity. For example, right now maybe you're seeing some of the numbers that for last week, but you should guide yourself into what you're seeing with what you have. And that way you reduce your frustration and start thinking, well, what is happening, right? So we're seeing the mortality going higher, the infection going higher, what we did wrong, and you kind of know what happened, right?
What frustrates me, doctor, and let me explain. What frustrates me is that a lot of times, because the information, and this is the beef I've had with the news media here. I hate the news media. I hate the local news media. I think they're a disservice to our community 100%, because they don't are out there producing information that would basically hinder or hurt maybe someone that's trying to put advertising money into their pocket. With that said, that's my opinion. But my concern is that I and a lot of people give me crap. They say, oh, that's what you're just trying to scare people. No, I want to give people the facts. I want to give people the numbers immediately, para que tomen un poquito más de precaución, for them to be a little more conscious. Because what happens, Dr. Cerdan, is that a lot of people go like, no, hay confusión. Erasmo dice que murió en dos. Look at the 21-year-old. The 21-year-old that passed away on Sunday, sir. The 21-year-old passed away on Sunday, and still Cameron County is quiet. Still the news media are quiet. Still everyone's quiet, and we get 20-year-olds coming out of our butt reporting positive. Pero se confía la gente, and that's what becomes very, very frustrating. You know what I'm saying?
Yes. Now I understand what you're saying. I definitely understand your frustration now. So yeah, I mean, obviously having a more accurate numbers right away will definitely help. But obviously, at the same time, it's hard for me to understand why it may take some longer period of time to make it appear, and maybe they want to make it more official, more confirmatory that the patient actually got infected, plus, the cause of death was the coronavirus and not something else. I apologize that I cannot tell you like the reasoning for that, but I definitely understand your frustration, and I share it, because obviously the more the community is educated about the number of cases, and it's more accurate, obviously the community can know how to maybe understand better what's happening with infection.
An informed community is always going to be hopefully precavida. I'm not sure. I understand that the board makes the decision on the superintendent extension and salary, but I disagree that AOBE has no say in the matter. If you represent the interests of the teachers, then why does AOBE not address the high salary of the superintendent and its contrast to teacher salaries? I think that's for you, Michaela.
Yes, it is for me. I can assure you that AOBE is advocating. Again, there's some things that I cannot disclose, but I can assure you that AOBE is advocating constantly in regards to employees and our safety, and of course our compensation.
Well, I'll say it. It's stupid ridiculous. It's stupid ridiculous, because this superintendent just got an extension to his contract based on what? What has he done? Nothing. Nada. Nothing but cause confusion. Nothing but put the safety and the health of our students, of our parents, And are our teachers at risk? Nothing. Nada. What is AOB doing to protect us staff after they said no mask required in children in schools? I choose to wear a mask when we go back because I am one that gets everyday thing that kids get. That what PPE is required in schools now. I work SPED and PPCD is going to be very hard because they like to touch, hug all the time. Michaela, I think that's yours too.
So AOB, together with the Texas State Teachers Association, we're advocating safety, and we will not accept anything other than safety. So we are advocating for a facial mask, for temperature checks, for hand sanitizing. We are advocating for safety and nothing more than that.
Let me tell you, the mandates for BISD and any other school district out in the state of Texas that does not require face coverings for staff and for students are dumb.
Michaela, recently we have heard from neighboring school districts in Elsa and San Benito closed up shop per se for a week or so at the main buildings. Is that something that AOBE would be asking of the district to try and be more proactive in regards to this?
Yes, we have been advocating for that. We have also addressed how elevators are being used, the time clocks, asking that we not use those time clocks and be able to clock in another manner, either just by clocking in your personal computer. As we see that things are being required, of course, we continue to advocate and we address it directly with administration. We also communicate with board members as well. So we're trying to focus in every fashion that we can so that we can get what we need, which is safety.
The reason that things are taking so long to report numbers is because of the asinine way they do things. And this is a comment, it's not mine. And the fact that the county health department is understaffed. Staff are required to make contact with the infected person and determine the reason they were infected, rah, rah, rah. Numbers are not released until that info is collected. It's madness, madness. Doctor, how long do you have to wait to get close to an infected person?
So it's approximately 14 days, but I'll suggest that you make sure that whoever is infected gets a negative test from nasal swab.
While I was doing remote teaching, I would share a social story with my special population about what COVID is, why we need to wear masks, and why we need to social distance. We would discuss it twice. Maida, that is amazing. See this is the kind of this is the kind of individuals we have teaching our students. We have amazing personnel, amazing teachers, amazing counselors, amazing. This is great. And other teachers that are out there, counselors, pick up these tips. They needed to see it, hear it, and help some of my parents out as well. That is teaching. That is being an educator, because you don't only educate or teach the children that are placed in your hands. You educate the parents and the community as well. That's what we need here in Cameron County. I mean, in Brownsville, Texas, we need to educate ourselves in regards to everything that's out there. Ask questions. And, we're very blessed to have, and, Dr. Cerdan, I'm not trying to kiss your butt, but I mean, if I have to, I will. But
what?
We're very blessed. No, but, I'm shocked, doctor, really shocked and very, very humbled that, y'all, and I've said it before and I'll say again, that y'all take time out of y'all's day, your family time, you have children, you take time out of your professional life, to do telemedicine and everything else to the benefit of a community. And it's very, very telling of who we are as people. So again, I want to say thank you, doctor, for everything that you do, man. It really is very, very heartfelt.
As I said before, and I'm not trying to kiss your ass, but I think it is important for the community to understand what is happening. And I'm trying to help as much as I can to educate the community about the coronavirus, about how it's transmitted, why the surge again, what's happening, because I think education is the best way to prevention. We need to educate to allow them to understand what's going on in order for them to reduce the chance of getting infected. And obviously, if more people gets less infected, then more chances we're going to be able to control the disease and have a better number of chances of survival in our hospitals. So you guys are amazing by doing this type of live events, and asking physicians that are in the front lines trying to help our community. Because if we spread the word, if we educate our community, the better it's going to be for everybody.
Yes, thank you. Now, one of the comments that's constantly made, I've talked to many teachers, and they are scared that they will get fired if they don't go back. Lorenzo, that is one of the guys. We are a community, guys, and I'm sorry. Look, Michaela, Michaela Escobar works for the district, guys, and I'm going to say this, and I'm not trying to kiss her butt either. But you know what? I'm very, very proud that individuals from the district are ready to take a stance and ready to face, end this fear of retaliation and tell them no more, no mas. I've been very impressed with the amount of teachers out there that have become very, very vocal. I mean, you've seen a couple of them on the thread. We throw them on here. And if you think that the stupid superintendent and this corrupt board is not watching this show religiously, my God, let me tell you something completely different. They are. And I mean, I'm very impressed that teachers come out and say, we're afraid, we're scared. What about my children? Again, going back into the Dr. Cerdan, you have children. One of the concerns that our teachers have, doctor, is that, they want them to do remote learning, distant learning from campus. Y dicen los maestros, oye, pero ¿quién va a cuidar a mis huercos allá en la casa? And it is very.
I know. It's really hard to. Obviously, I don't know the dynamics of the school, and I don't know how it is. But as I said before, if there's a way of giving the opportunity to the family to take the choice of tele education, homeschooling, or live education, that would be great. Now, can they maybe pre-record, right, in their allowed time? I don't know how they can do that, and I don't want to get into that because I'm not an expert on it. But I think that could definitely reduce the risk for infection in the school, and obviously help to release some of the stress on the family of obligating their kids to go to school if they don't want to.
Well, one of the things that's going to have to change, Doctor, and you mentioned it, Dr. Cerdan, and I think Michaela mentioned it as well. One of the things that you mentioned is, I don't think we're going back to normal anytime soon. So
no, it's not.
Our school district, and we've talked about being, creative and innovative y todo lo que tú quieras. School district is going to have to change, pero they don't want to change. O sea, están obstinados. They're adamant that it has to be this way because we've always done it this way. It's got to change. I mean, times are changing. We are facing something that's very, very different. The issue is that they don't want to lose any of their funding. They don't want to lose any of their money. They don't want to lose anything that they could put into Sylvia's pocket. That's the whole issue. It's all about the damn money. And that is frustrating because there are other options. We just have to open up our minds and say, hey, this homebound school work. I mean, can we put, so many children over here and put them in a different type of virtual learning establishment? We're in the 21st century, for goodness sakes. Let's start thinking of other ways of doing things because nothing is going to go back as life as we know it. And I'm not preaching it's the end of the world. I'm just saying let's learn how to live in this new world, this new hand that we've been dealt by something that no one could prepare for. But let's start taking measures that make sense and let's not be stupid about them.
Now, if I may.
Yeah.
One of the things that I want to tell you is that AOBE is a member organization organized by members, and everything is transparent. I mean, we have our membership fees and everything has been audited and so on. But most importantly is that we are the ISD. We need to stand in solidarity and say, you know what? Safety is first. I am an employee of BISD and I am afraid, but I'm not going to stop taking care of myself because I'm afraid. I'm going to say, you know what? I need to be protected because I am worthy and I am an employee. I service my community. Now, what are we in AOBE doing? We are proposing, of course, safety first. We're making sure that we are being compensated. We are making sure that they look at every employee and see what we have faced. because all of us had to work from home one time or another, and we had other expenses that we did not have. So our stipend, and I want to thank every single person that signed our petition. We took it to the board, and it will be reviewed this Thursday. So we're asking that everybody go, if you can, and express that, yes, we deserve it because we work really hard. Now, the safety of the children is very important. We have to make sure they're safe. And we know that some kids are not going to be ready to have a mask in their face. Because if we as adults are uncomfortable, imagine our children.
Bitch it up.
So one of the things that we all are also proposing is that for those that work at the schools, that they allow for us to bring our kids. Have a room, not necessarily as a teaching or having an instructor there, but as a daycare. Someone just to watch over them. That way I'm working, teaching if I have to, but I have my child next to me. And I know that he's going to be safe, has the Wi-Fi, has the food, of course, through food service. And why not? I mean, let's look at different options to make sure that our employees are taken care of. And we need to stand together, and we can make a difference. Remember, if every teacher, every educator, because even the bus driver is an educator, if every educator votes, we can make a change.
Well, a change is needed. I mean, change is needed. And again, going back into what Dr. Cerdan said, all aspects of life are going to be changed. You know, we're going to have to make modifications. We're going to have to give in. A lot of things that I used to enjoy before, I won't be able to do anymore, man. But you know, it's like getting married. You know, not that I know anything about that, but it's like getting married. You know, you get married with someone, and they come with baggage, bro. You know, and if si no quieres entrarle, no le entres. Pero, you know, you have to change a lot of things, you know. If you like sleeping on the right side of the bed, pues ya no vas a poder sleep on the right side of the bed porque la doña quiere the right side of the bed. So, you know, you have to give in a little bit. Well, La Rona is our new wife, you know. La Rona is our new husband, Frankie, for you. You know, it's just, and there's nothing wrong with that, Frankie. And, you know, that's just the new reality that we're dealt in, you know. You're going to have to sacrifice a little bit. Ya no puedes irte a parrandear como antes, Frankie. Ya no puedes ir a hacer cosas, tus vicios, Frankie. Ya no puedes hacer eso. You know, now you're going to have to do more like me, by myself. Solo, triste y agüitado. Traigo triste el corazón. No, but we are going to have to modify our lives, Dr. Cerdan. We have to, you know, make changes, make sacrifices to allow them to enjoy it.
I agree. I think that we're connecting both seasons. I don't think this is going to go away. So
No.
we need to start planning our school year, and we need to know what we're going to do, because this is sadly, thank you, Leslie. I reading your comments, nice comments. So thank you so much. This is going to connect, guys. This is going to connect. I think I was hoping that this COVID-19 will act as all coronaviruses, but it doesn't look like it's happening. Maybe part of it's our fault, as we discussed in the beginning. And we need to start planning of how we're going to reduce the chance of getting or spreading the infection more, because even though the numbers are getting high and higher, we still have a lot of people in the community hasn't get an infection, and we need to prevent this wave to get a bigger, newer, higher, number in infection, and so we need to be very, very careful.
Here's the question in regards to the O blood type, Les. And again, I know we answered partially before, and have gotten this question in regards to.
No, it's not getting the infection. It's about the risk of complications, right? So we answer it.
Yes, we did answer it. So yeah, we got it. We got it in there. Dr. Cerdan, it is discovered that a company in Conroe, Texas, is responsible for contaminated test kits due to poor working conditions and non-sterile methods. Would those tests for the specific company be the culprit for all the false positives coming up?
So first of all, I don't know what you're talking about. I apologize. Maybe I'm not reading enough recently on the community, because I'm spending more time in the hospital. So I apologize, but I don't think so. You don't get the false positives or like that. Again, the numbers are high because the infection process is going up and the contagious it's higher now, and so we need to be careful with it. Be more careful in the community.
This is a good one. Why is it important to cover the nose with the mask? Because it's hard to
right.
On. I thought it was transmitted through Doppler.
No, but I mean, yes, but when we sneeze, when we
And then,
cough, no, we spread it
yeah.
through our nose and on our mouth. Even when we talk, you may not realize it. Remember, the mouth and nose are connected in the back. So when we're talking, coughing, sneezing, we're it's called droplets, which is basically saliva and mucus to the community and to the environment, and that's how we can get it. So yes, cover face and mask, the whole thing.
It is very uncomfortable, and that's one of the reasons why I'm going to have to go talk to my lovely friends at Episcopalian Church School, Episcopalian School, and say, "Hey guys, why haven't I gotten one of those clear plastic masks?" And
Now it's like everything. You need to get used to it. Okay, so it may take some time, but you need to get used to it, right? It's a protected device, and you need to use, and it has to be mandatory. In that way, you use it, okay, and don't get in trouble. And the more that you use it, the more comfortable you're gonna feel.
yeah, what is the difference between the face covering and the face shield? Can is one better than the other?
It's I think in my point of view, both are necessary. So one is covering, protecting more your nose and your mouth. So this is the area. But we also know that the virus can also spread to the eyes by rubbing our face, rubbing our eyes with our contaminant fingers, can also produce infection, can also cause infection and disease. So using the face shield can help you to prevent those droplets to get into your eyes, and it also prevents you to touch your face. So I'll advise to use both if you can. Obviously, I know that it's hard.
Both at the same time?
If you can. I'm not saying that has to be, in my opinion, the mandatory should be the mask. All the time. You step out of your house, you need to use mask. That's how I will address it. But if you want the extra protection, you want to be extra careful and you can handle it, you can use a face mask. That'll be good. A face shield, I'm sorry. That'll be good.
If a person was exposed to a positive person but tested negative, are they safe to go back to work the next day? How soon can you get tested after being exposed?
So yes, you can go back to work as soon as you're tested negative, right? So remember, so the nasal swab may take between 3 days to 5 days to be positive or negative, right? So unless you do the antibodies are not as good as the nasal swab, but as soon as it is negative, then you're allowed to go back to work. Otherwise, you should be socially isolated. So let's see that you expose yourself to somebody that you know that it's completely positive, that you know that it was positive, and you've been interacting with that person. Then you need to take yourself into social isolation for until the test come back negative. Okay.
Michaela, what is the organization's thoughts on the potential risks of going back to school? Does, and I hate to say this, but is litigation a possibility of on the teacher's behalf if for whatever reason they were to contract this virus?
I'm not sure about the litigation part of it, but I know that we are working not only with TSTA and the national organization NEA to make sure that safety is guaranteed, and we will continue to advocate. I did do some research in regards to employers and workers' compensation. The problem with that is, how do you prove you got it at work?
Yeah.
Being that the virus and it's basically everywhere, how do you prove you got the virus at work? All we can do is, of course, maintain social distancing, practice what the CDC does or recommends. But other than that, I mean, we continue to advocate at the local, state, and national level.
Let me just evening as well. Are those positive numbers from individuals tested in Brownsville, or are those the total cases in Brownsville? The thing is that there are many patients that being transferred from other nearby cities to our local hospitals in Brownsville. Could that be another reason why the numbers in Brownsville are rising? No, Luis. The numbers in Brownsville are rising because people are being stupid. That's why the numbers are rising in the city of Brownsville. People are not social distancing. People are not staying away from each other. The stupid superintendent and the corrupt board, they're out there promoting graduation. They're out there promoting students coming back to the campuses for athletic training. They're saying no face masks coming in fall. That's why our numbers are rising. So no, don't be. I'm surprised that they're as low at 76. I'm surprised, really. And I think that one of the things, and I've said it tonight, and I've said it before, we're not getting all the numbers because they have to contact family. They have to do all this other stuff that they do. And again, I'm bashing the county. What the friend just said through the text. What I'm saying is the reality that we're living in, as long as people don't social distance, as long as people don't wear face coverings, as long as people keep on listening to this stupid superintendent, the more positives we're going to get. It's math, and I'm horrible at math. Horrible. It's not going to change. So yeah, I'm not surprised that the numbers are 76, bro. I'm not surprised, and I'm not mad with you. I'm just frustrated with the situation. It's not surprising that they're 76. We probably got 120 today, 130, but we won't find out about them until the next 2-3 days. And that's frustrating. You know, and I'll give you an example. Sorry. But you know, when in Hidalgo County, all of a sudden, estaba dando 0, 1. You know, I don't know if y'all remember that, but they were reporting 1 or 0, 0, 0. Y toda la gente, oh, ¿ya ves? No, todo está bien. No, hombre, ya pasó todo. Y de repente, boom, the next day, 76, 90 something, 100. 140, now 200 and what? 200 and something?
248. 248 today.
248.
2 deaths.
And 2 deaths. So that's why it frustrates me. You know, we need to keep each other informed, but people, goodness gracious, maintain social distancing. The more you do this, the more viejitos and children are going to be placed in harm's way. Risk of actually losing their life. And look, guys, a lot of these viejitos, they got another 5, 10, 15, 20 years more, man. And because of irresponsible people, andan ahí las viejas fodongas en el Walmart y en el H-E-B, para arriba y para abajo, con 20 huercos sin máscaras, guys. We're never going to get out of it. Never. Sorry. Never. Is there any testing site for BISD employees? No. And there should be. But I know that BISD employees were out there filling up 2 weeks ago. They were sent out there as soon as they started to get, I agree, except the fire chief and his administration. Well, yeah, they wrote it up. But, I have a question. Going into the fire, one of the cases that I experienced this weekend, doctor, was a very upset young girl that maybe not too young. Sorry, but the ambulance wouldn't take their mother to the hospital. She was COVID positive. They wouldn't take her to the hospital. They said, "Búscatela como puedas." I mean, why are ambulances, EMTs not taking individuals to the hospital? Do you know?
I'm not sure, to be honest. That's the first time that I hear something like this. I think it should be an obligation of taking them to the hospital and clean even if they know that it's positive. I think there should be, their obligation as an ambulance. And definitely if the patient is suffering, definitely if the patient is having shortness of breath or some sort of risks, and there's their own obligation to promote safety afterwards by cleaning the ambulance. So I'm not sure what happened.
Well, I try to explain it. While I understand that, maybe here in Brownsville, sir, I don't know if you're aware, but here in Brownsville, we have 6 ambulances. 6 ambulances for the entire community of Brownsville and Cameron Park. That's madness. It's not enough. It's
definitely not enough.
Not enough. And I mean, and God knows it. And my people here, they know. I've been complaining about this for years. 6 ambulances for the size. Now, we have 185,000 residents by lo que dice the green signs out there. That's what the green signs out there say. Brownsville, 189,000 residents. That's not true. We have closer to 250,000 people here in the city of Brownsville because guess what? A lot of the people aren't registering on the census. There are a lot of individuals that live amongst us that do not have papers, that are here illegally. God bless them. I love them all. But because they're not registered out there, 6 ambulances isn't enough to service 189,000 people. We need
I agree.
at least 6 more ambulances for this town. At least. But with that said, if and you know, and again, I understand that the city might not want to expose their first responders to it. Again, all I want is more information. You know, o sea, give me a solution. You know, they are the professionals. They know, and if you know they can't provide the service, well, give me a solution. Dime qué es lo que puedo hacer, o diríjame. Show me someone that might be able to share with me the information, or might be able to provide the service, or something. Algo.
Mm-hmm.
Dele Basan, thanks for Dr. Where in law went and where it was exposed, tested, and patients. That was, yeah, being exposed is not a good thing. I'm not understanding your question, Memo. Some of the positives don't show symptoms. Why?
That's a very good question. We still don't know why. Maybe their immune system is better. Maybe they don't have other comorbidities going on like hypertension, diabetes, dyslipidemia, which all Hispanics sadly have, or a high number. That is probably the reason why we're living a higher risk community. So yeah, most likely is comorbidities, age, associated with more symptoms. But as I said before, maybe blood type or other things going on that we're still investigating.
You guys talk about what you guys want, not what people put on there. Do you know how many comments we've gotten right now, bro? I mean, I haven't even gone through half of them yet. So don't come out here and whine and complain that, oh, my comment didn't get placed up there. If you have such a concern, send your comment in, send your question in before time, and I'll make sure it's put up there. But don't go out here whining. I'm trying to put every single comment out there, Lorenzo. Be good to me. I still love you, though.
Hey, Lorenzo.
Mr. Escobar, is there any... look, I played, and going back, Lorenzo, I mean, I put comments up here that I don't agree with, you know? I mean, I even put up the comments on the empiezan a echarle maíz a Erasmo. I still put them up. I blocked the people afterwards, but I still put them up because I'm trying to be as transparent as possible. What are you talking about, Lorenzo? I still love you, though. Mrs. Escobar, is there any plans for BISD having a daycare for caring of employee children? Wow.
We are listening to our members. One of the things that we did research is that TA is asking school districts to accommodate. So we did a survey. Our members answered back, and yes, they do want daycare. So that's one of the things we will be advocating for.
So unlike the district, y'all actually do listen to your surveys.
We do.
Half of these parents don't work and are on welfare and will send their kids to school because they don't want to take care of los huercos. Have you seen some of the huercos out there? I wouldn't want to take care of them.
Angels.
I wouldn't want to take care of them either. No way, Jose. You should also invite the doctor that went viral in his video from Harlingen. Actually, I have invited the doctor.
The doctor. He said
that doctor has not responded, but we sure did off extend the invitation. You know, one of the things that we try to promote, guys, is, again, you know, as stupid as a comment may be, or a video may be, or is irresponsible, you know, we want to hear everybody out. Everyone deserves to be heard out. With that said, I could easily say that not very much in agreement with a lot of the things that were placed out there. But, you know, guys, that, you know, one of the hopes that I have in providing these services for you, service, is to educate, open your mind, expand, and do some research. Dr. Cerdan.
Now, I was wondering, I got confused. I'm kind of wondering which viral video he's talking about, because remember, there's another very good viral video that came out recently explaining, you know, what most of the community physicians thinks about so maybe he's talking about that one.
If we're talking about Hassan,
yeah, Amir Hassan. Yeah, he got an amazing video explaining what, you know, we as a health community think about the virus and the infection. And you know, thanks you guys for sharing it too, because it was a great video.
Actually, and I have spoken with Dr. Hassan, and Dr. Hassan has stated that right now, because of everything that is going on, and Doctor, you know, very, very busy, but, you know, he will be with us next week or in a couple of weeks. So again, very, very proud. Again, the doctors are, man, let me tell you guys.
He's a great physician. I love him. I'm a stroke neurologist. He's also a stroke neurologist, but he's also a neurointerventionist. He performs a higher level, like he's a well-renowned physician that does a lot of good things for our community. So hopefully you can have him in your show because he's great.
Yeah, I again spoke with him. He says right now it's kind of a busy time because of the increase. It's understandable. I said, doctor, I completely understand. He says let's plan for something next week or the previous week. And I said, doctor, whenever you can, thank you, very appreciate it, because I really did enjoy the video that he placed out there. Very, very informative. Very data and very fact related. Are private schools required to follow BISD guidelines regarding COVID? No, they do their own thing.
Dang.
Tell the truth. About what, bro? Lorenzo, pórate bien, Lorenzo. It's a cover up. What's a cover up? You're welcome. The symptoms don't show right away. As a safety measure, quarantine is the best option. Well, social distancing does wonders. Be more like me. Be isolated, a loner, solo, triste, abandonado. Dr. Cerdan, are you taking new patients?
Yes, we do. Well, right now we're only doing telemedicine, because obviously we don't want to expose the community to infection right now. So to the virus. So we're trying our best to avoid personal interaction at this moment. But yes, we're open. So we'll post the numbers later.
We're still here watching. Arvin, I love you. Love you, Arvin. What causes the delay to get results? Using different labs, too many batches of it. I'm going to say that the huge number of individuals have you seen the lines out there to testing sites?
They're running out of tests. Erasmo, I've heard of Los Fresnos, San Benito, La Feria. Some people standing out there for 4, 5, 6, 7 hours. So, we hope that everybody, gets tested. But it's apparent that Cameron County, for whatever reason, as of right now, does not have the adequate number of tests available at this time.
Well, they've started to limit the number of tests to 125.
Yeah,
125. Goodness gracious, guys, the lines out there. Y a las tortillerías también, pero the lines to the COVID tests are bad to the bone. Everyone needs to help AOBE leadership to show the united displeasure of the board's decisions to alter the contract. Look at guys. Hay que no hacernos los tontos. It wasn't an oversight. They were trying to play you dirty. That's the truth. They were trying to play you dirty, underhanded, and oh. Guys, they look at every single number. They have to. That's why they pay those people so much money up there. So it wasn't an oversight. They were planning to get away with it. They lied. They got caught. I know Michaela won't respond, but I will. They got caught. Qué bueno. And the only way that we're going to defeat corruption in this area is by uniting and getting together and, standing united. And it's the same thing with this Corona 16, Corona 10, or COVID 10, COVID 16, or COVID 19. Same thing. The only way that we're going to, get over this hump, which the hump hasn't gotten here yet, is by working together, all of us together. Michaela, does Sylvia look like a penguin? It's a good question.
No comment.
Almost had you. Sylvia, give the money back. Why not disclose transparency? Preach. Now you tell the truth. Love you, Lorenzo. Mwah. Love you. Thank you, Erasmo, for saying what the unions won't say. Bro, I'm Erasmo Castro, bro. There can be only one. It's not easy being the king of all local social media. It's not. It's a big burden. Answer given to me by CCHD. We are backlogged. Yeah. And that was in April. I was upset with them because the public is not made aware in time. It takes weeks, and then we use HIPAA as an excuse. I hate, I understand. The public doesn't need a name of the person, only the knowledge that someone has positive. Yeah, I hate the HIPAA excuse, and I've gotten it so many times. Just give us the damn numbers. But the masks that they might give are going to be reusable for how many days or months? Don't know. But I know that there's a lot of, they're advancing technology in regards to masks as well, aren't they, Doctor? They're coming out with new things now that people can use, no?
Yes, yes, yes. And you can also, depends on the type of mask, but you can also wash it and, reuse it. So, yeah.
I have a question for Michaela. It's going to be kind of long. Is that okay?
That's fine.
Erasmo, I'm a big fan. Yay! Finally, someone. I was one of the choir directors. Choir. I noticed someone commented saying the issue was only with band, not choir. Not true. We had a meeting with our choral supervisor via Zoom. Only middle school choir directors are being affected by this, not the high school choir directors. They are saying that there will be only one choir director per campus, which is not fair. We have 220 students in average in the program, and those numbers call for an assistant, which many of us have not gotten as of yet. Sorry. Not complaining, but what about the big choir programs like Stillman and Garcia? Those schools are actually supposed to have 4 directors as per the compensation plan, and both recently, after years, just got approved for the 3rd director. We are very concerned about our days being shortened. We do so much and we get unnoticed. Our students and parents see it, but the district unfortunately does not. The MIZ middle school choir program overall has been thriving. It has. They're amazing. They've been thriving. I know that there are many unfair things right now due to COVID-19, but I just wanted to be the one choir director to actually contact you. I've actually gotten contacted by several, but I appreciate it. Talk amongst yourselves. I sang with you. Oh, yes, I know who you are. They're going to say, Michaela, what about the choir people?
Okay, so we did address the days for both the band and the choir, and it has been fixed. At least that's what we were told by administration. Supposedly it was an oversight and it has been corrected. The corrected compensation plan has not been posted yet, but we will verify as soon as it is to make sure that it was corrected. Now, in regards to the ratios, I have not researched it, or at least the AOBE board has not researched it yet. So as soon as we are done with this, we will get to it and we'll see what needs to be done, because we only have until Thursday to review and ask for any corrections. Now, we did send a survey and we advise every AOBE member to review the compensation plan, and if there is any discrepancies, let us know. Email aobeadvocate@gmail.com so that we can address it immediately. We only have 2 more days. So the dates have been corrected as far as we know.
Michaela, what about our art teachers? I just got word that they will be cutting teachers on campuses, so there could just be one in each school. Is that accurate information?
Again, without having the question before, I cannot answer that question, but I can go back to the compensation plan and look at the ratios to see what it looks from the current to the proposed. We have not received any concerns in reference to that as well. So I really can't answer that question at this time.
What about counselors not changing to 196 days from 187 to get the daily rate? Are they cheating the counselors?
As far as I know, the days have not changed in regards to the counselors. Okay. I know that we're trying to move them to a different scale, not necessarily the administrative scale, but a different scale from the teachers. But what we were told from administration is that their stipend was embedded into the salary.
Vía Juanito. Guys, póngale a Juanito la mendiga máscara, please, guys. Póngale a Juanito la mendiga máscara. And to all the mujeres fodongas that are out there in Walmart, HEB.
Leave your kids at home.
Guys, leave your kids at home, mujeres. And husbands también, esposos fodongos. Leave your damn kids at home. Don't be taking them back and forth, back and forth. It's not a damn carnival. It's Walmart. Go buy your Pampers and your groceries and go back home. It's not the mall. And cover that pancita, please. Please. My 2 daughters are teachers and they are scared. Yeah, a lot of people are scared. I vote for kids to be schooled at home. Yes. Let's see what's going to happen. To teachers, they small children. Yeah, that's exactly what we said in regards to them going back home. Michaela is the best advocate for justice. I know. We are in the city where I'm the city manager. Find business owners, one that is providing products and services. Oh, doctor, do you think the finding of the businesses is going to help? I mean, it's help.
I think so. Whatever we need to prevent this to spread, right? Even I think it was $500 for for the community, right? Up to $500. Is that correct?
Well, I think per establishment, I think that
No, per establishment it was more, but I think per, like, if you're not using the mask, per individual, I think it's up to $500.
Did you see, Doctor? Did you see the videos of the bars after the governor, opened that back up? Did you see the video?
I saw some. Yeah. Yeah.
When I saw when I saw those videos, Doctor, I knew that these lists were going to come out as bad as they did. I knew. Dije, chinteras, chihuahuas, and dicho y hecho. It's kind of weird, but it seems like the farther we go through all this coronavirus, it's like, you start to become an expert, and you can easily start to predict.
Right, I agree with you.
But one of the things, and again, and this is what a lot of these people don't understand, and it might be me estoy echando de flores yo mismo, but I'm very in tune with the community, and I'm in tune with the community because I interact with the community everywhere. So I have a sense of being able to predict this, and this might happen. Yo creo que me voy a poner como Madama Palma y empezar a leer las manos. Vengan conmigo y yo les digo el futuro. Man, I could be making tons of money. Dr. Cerdan, any last words tonight?
Well, thank you again for inviting me to your show. You guys are great. I really appreciate your time and the opportunity to speak to the community. Again, probably nobody's listening at this point, but
there's a lot of people there.
But please, if by any chance you're still there, you're by any chance watching this on our replay, please use your mask. It should be mandatory as soon as you get out of home. You're out of home, please start using your mask. Practice social distance. Wash your hands. I'm never going to be tired of saying all these things because it's proven, and Erasmo can actually show you that article. I gave it to him recently. It's proven that the virus is mostly spread by the air, the fomites that we produce, the saliva that we actually throw to the community when we talk, speak. And the best way to prevent this to happen is using masks and practicing social distancing. So please keep doing that. Help us, help the community to continue being with the resources, helping the community to try to control this to getting out of hands, because we're very close for that to happen. So please help ourselves and help yourselves to prevent this to go out of hand. Okay. So thank you so much for inviting me. Thank you, guys.
Thank you, Dr. Cerdan. Michaela, any last words?
First of all, thank you for inviting me. I want to also tell you guys that we need to stand in solidarity. We have the power to make the change. We all educators, from the bus driver, food service, custodial staff, teachers, counselors, everybody, if we all vote, we can control what we have. Safety is first, but we have to stand together in solidarity. Remember, if you need help, AOBE is here for you, 956-621-3010 or aobeadvocate@gmail.com.
Thank you. Two small questions, but maybe into one. Is there another way of testing other than the nose swabbing? I think there is the spittle, and there's actually a blood test, an antigen test or something?
Right. So there's a blood test, a rapid test. Some of the community physicians have it too, and blood test too. So you can get an actual IgG and IgM. It takes more time than the rapid test, but it's probably more accurate than the other one.
The last one, is prolonged wearing of a mask detrimental to health?
So, meaning that using it all the time, or what do you? No. I think unless you're exercising, I think this was discussed earlier in the live event. But no. You should be fine if you're using it most of the time. You should be a problem.
And I was going to ask Michaela a question.
Yeah, go ahead.
Michaela, how can we find out if we are considered beginning, midpoint, or max on the compensation plan? No one answered the phone at BISD today, HR.
I'm pretty sure they're overwhelmed. Okay, the only way you'll know is look at your salary, and then you have to look at the new compensation plan and see where you would be. and it states there the minimum, the midpoint, and the maximum. Now, if you see a discrepancy, if you are an AOBE member, call us and we can address it immediately. If you belong to other organizations, I suggest you call them, but join AOBE. We're the only organization with state and national affiliations. And not only that, we have employment liability insurance. Now it sounds like a commercial, I'm sorry, but we stand for you. And again, we have to stand together in order to make sure that we have safety first. We need you guys. We need for you to stand with us. So check the compensation plan. Is there posted online? Go to the BISD website, go into the board agendas, select, I think it was the board budget meeting, and it's right there, the last link. You can view it there.
Awesome. Saludos a Mario Medina. Frankie, last words.
Once again, thank you, Dr. Cerdan. It's always important for us to hear from those individuals at the front lines. You are risking your health for our community. So thank you so much, sir, for everything that you and your colleagues are doing for the city of Brownsville and for the Rio Grande Valley. And Michaela, I want to congratulate you on your statewide election. We're very proud of you, and we know you'll be doing an amazing job. And once again, AOBE has always been at the forefront ever since this, ever since this COVID started. They've been the most vocal. So thank you to your organization, and I highly consider y'all to be one of the premier, unions out there. So congratulations on that too. Thank you to our public. It's been an hour, close to 2 hours, and we have an amazing numbers. It's very important for us to have a variety of guests here. That way we can always keep our community informed. It's important for us to get the information as quickly as possible. We're not here to convert anybody. We're not here to brainwash anybody. We're here to provide information. You have to do your own research, and then create your own narrative in your head. Thank you so much for your patience, guys. We will be here as long as you all will let us. And I know we'll be here for a very long time. So thank you so much, guys.
I love you, Edgar. Guys, thank you again, Dr. Cerdan. I love you, man.
Thank you, guys. No, I love you too. So I appreciate it again. Once again, thank you so much for your time. You guys are doing amazing things for the community. Keep doing what you're doing, and let's spread the word. Okay, prevention is the new normal.
Prevention, Michaela. I don't know if you call you Michaela or Mrs. Escobar. Now that you are an elected official with the state representing not only BISD but also Rio Grande Valley, is that correct?
That is correct.
Congratulations again. And thank you for being on. We're going to extend the invitation. There's a lot more questions for BISD. And I think the reason is because there's a lot of uncertainty in regards to a lot of the things that have tried to happen. So we're going to ask to see if you have a couple of minutes to come back on tomorrow. That'd be great. And
make sure that they email you the questions so that I can have the answer.
Yes, guys. We'll put up a post. Hardly anybody sees my page anyway. So, but whoever does, we'll please, guys, have questions ready. We'll send them, and it's not that we don't want to ask them live. We'll ask them live as well, but that way we'll get a lot of the great questions out there. BISD and TV members should join AOB. Let me tell you, Best needs to stop puckering up and kissing the butt of the board members. That's my take. Guys, have a great evening. God bless. Take care. I'll be with you here tomorrow at 9 in the morning. Get more information. God bless. Take care. Take care of each other. Take care of me, please. Bye.